We have actually a lot of cases, but I can remember recently one of the cases, and you can imagine if you are sitting with your family and suddenly you have severe chest pain, leg pain, and you can't breathe. This is the condition which we received recently 1 week back. Very young male patient, he has suddenly pain and he can't even walk, he can't breathe, and directly came to the emergency. As we received the patient, we have seen he has what we name deep vein thrombosis, clots in his deep veins in the legs, extending even to the abdomen, to the belly, and one part of these clots swim with the blood flow up to his lungs, and that was the dangerous moment. It was life-saving because he can't breathe well, he can't get oxygen, and the saturation will go down. In this case, it's different from limb saving a bit because you are under pressure, time pressure, you must save the life as well the patient limbs. And we went directly in our catheter lab, and we were able through complex techniques to get out all of these clots. The patient suddenly came back to normal. You have patient, he's struggling for his life. You will just aspirate with the catheter the clots, and the doctor, the anesthesia doctor, he will tell you directly, you are working, you are under time pressure. He will tell you, patient's doing well. And that is the moment when all relax, patient and even doctor. And this is a case which is come frequently. Patients are not aware about such things. If they have swollen limbs, if they have sudden pain and swelling, if they have sudden difficult to breathe, they must really go directly to the hospital because it can escalate and be really life-threatening case. This case called deep vein thrombosis, complicated with pulmonary embolism. Deep vein thrombosis mostly happened in the lower limbs, and the dangerous part of this deep vein thrombosis, the clots can travel and go to the lungs. And in this case, there is need for urgent response from the medical team, and the patient must be aware. Also, if he has any sudden swelling, sudden pain, sudden difficult to breathe, direct to the hospital because he hasn't a long time to save his life. For such clots or such cases with deep vein thrombosis and pulmonary embolism, nowadays the most common cause is sedentary lifestyle plus overweight. When we don't move, the sluggish blood flow, it's high risk to develop clots in our veins. But we know usually the hormones, especially pills, that's why DVT or deep vein thrombosis is most common in females. Such patients, they have genetic disorders. That means they have genes, inherited genes, and they tend to make clots more than the others. And if the patient came to us with life-threatening case, we deal direct with the acute cause. We remove the clots, but later we will give the patient blood thinner for a while, depend on the diagnosis. And there is work out to check why he gets these clots, and on the other side, how to protect him for the next time, as how to prevent another clots. For sure, on the other side, we named the first one non-provoked deep venous thrombosis. That means there is cause, but it's genetic, it's medication. On the other side, there's patients, they get clots because they have surgery. After surgery, mostly orthopedic surgery or cesarean for females, they will be bedridden for a while, and bedridden patient, they tend to develop clots even without genetics. And in such patients, there is even special protocols to prevent blood clots, but it's not 100% protection. To prevent or reduce the risk to develop clots in our veins, the number one is physical activity. Walking, cycling, any kind of physical activity. It can move our muscle, it can make our circulation better and prevent clots. Secondly, nowadays we are flying a lot, also during flights or long sitting or long standing, long driving, also any situation where we are sitting or standing without moving for a long time, we must be aware to wear compression socks or to move. If I'm working in office, then I must always thinking, okay, every 60-90 minutes I must move. I must move my muscles to move my blood and prevent clots. Patients, they are going to do any other surgeries, they must be aware actually, and doctors, they are already aware. They must be protected with compression socks, with blood thinner, depend on the surgery, small, big surgery. And during pregnancy, even if the patient or the pregnant woman has any swelling, any pain in the legs, she must directly go to vascular surgeon to make sure there is no clots and to know how to protect herself. That means we must avoid long sitting, we must avoid long standing, we must avoid tight clothes. For females, very important, hormones, contraceptive pills. If she can avoid it, it's for sure better. And if we know there is family history in our family, there is genetic factors for clots, it's better to visit the doctor and to make the tests to be sure if I have it, how to protect myself.